Hello, everyone. Just getting started here. Good morning, everyone. We're about to get started real soon, as soon as we have our other person, the wonderful Dee Magrini, who will be joining us. Thanks so much, everyone, for coming. I would like to take this time to give PSA, public service announcement. We are still doing rapid HIV and STD testing via appointment. So make sure you call us at our line. All the information is going to be posted in the comment section. Good morning,
Hey, how
or
are
good
you?
afternoon, I should say, Dee. How are you doing today?
I'm good. How are you doing, sir?
Good, thank you so much. So
Good.
once again, thank you everyone for joining us. This is our medical mistrust part 2 and COVID-19 vaccines. My name is Kevin. My pronouns are he, him, his. I work in the community health department.
And I'm Dee McGreeny, and I'm here with you from Whitman-Walker as well. And I am in external affairs, and my title is, let's see, Assistant Director of Community Commitment and Training. And my pronouns are she, her, and hers.
It's so good to have you back, Dee. It's a pleasure and a privilege to be here with you in this space once again. So let's get into it. We have a lot of content to cover. And once again, today, as part of our series, we'll continue the discussion that we started next week. Um, so Dee, last week we discussed Tuskegee. We talked about Henrietta Lacks and
Right.
many other historical events that have contributed to the medical mistrust that um, our communities experience. Now, should we discuss more about medical distress, specifically about the LGBTQ community? Dee, do you have anything to share with us in regards to that?
Well, I want to back up a little bit and
Okay.
just kind of offer just briefly again the Tuskegee study and the information around Henrietta Lacks is in public domain. So if you missed us talking about those things last week, don't worry about it. But I would encourage folks that are interested to really delve in. I think we shared some resources last week that are really accessible. You can
Mm-hmm.
watch a couple of videos and get a sense of whether you want to dig in deeper or not. Now, so for this week, I've really been focused on this subject a lot
Mm-hmm.
in the last little while, probably longer than that. But I did, from our conversation, pick up the LGBTQ question around talking about medical mistrust. And reading and then thinking about what I've read, my sense is that most of the problems within this community in terms of access and actual delivery of care are around cultural competency. And that's true for a lot of communities, but I think for LGBT folks, the idea of one, the name that dare not be spoken, heard.
Mm-hmm.
I mean, in terms of medical school and medical education, and just society in general, at some points, to speak it was a bad thing. So if you start from that place, just as Black and Brown people start from a place of less than human in terms of this discussion of medicine, if you are other, cast out from that center line of cisgender white male, that's going to already create a space where people are either avoiding discussing your life or not even seeing your life. But in medicine, that makes, and in science, that's a problem. So direct studies that affected LGBTQ people were difficult to find,
Mm-hmm.
mainly because the language is not used to either draw people into studies or education for that matter, or to discuss those that might have been included in whatever grouping you study. So that's what I've found. I did include some information from CDC
Okay.
and the Williams Institute. I will tell you is a really strong source of information. But to get a sense of where things sit in terms of research at this moment, I think those would be, especially holding Williams up a little more,
Mm-hmm.
places where we can go and try and get a sense of where research currently stands.
Thank you so much, Z, for sharing that. And I know that last week we briefly touched on Guatemala, and what had happened there back in the 40s. Um, so, do you have anything else to share in regards to that? As we're talking about our communities, our Black and Brown communities, and our immigrant communities, anything else to share in regards to that?
I do just a bit, and as we um, talk about how we segment communities to be viewed,
Mm-hmm.
I really want to encourage everyone. I suppose we do know this, but that LGBT folks are part of every community we're discussing. So it's not as though there's a separate community here or there or some place we can tie in. Part of the problem is that we're not viewed in our home communities in the same way, and language
Mm-hmm.
is not used to bring us in or to show us within the science. In terms of Guatemala, again, it was a sense of having some sense, but not fully. I
Mm-hmm.
shared a video, and I'm pausing because I found this particular business um, more disturbing in some way. There's no way to quantify it, but
Mm-hmm.
just briefly, I'll let people view the video as they will. But just briefly, these studies, as you said, took place in mid-40s, and they were looking at efficacy of penicillin. Uh,
Mm-hmm.
there was studies that were formed in a way that could not be done in the United States in the same amount of time. So scientists went to Guatemala. I don't know what
Mm-hmm.
machinations went on to get the study there and have it be okay, but this happens globally. The study went forward, and first they were bringing sex workers in Guatemala to prisons in Guatemala to
Mm-hmm.
try and create infection by syphilis. When that wasn't working effectively enough, they decided to inoculate people in prison already with syphilis. So forget the middleman, we're just going to give you this disease. They went from people in prison to mental hospitals and the military. And the
Mm-hmm.
woman that delivers this information gives it to you in a lot more detail than I will now. But to know that that some of the advancements that we enjoy have been off the
Mm.
unfortunate fruit of other people. So
Yeah.
just so we know this.
Definitely, the and thinking about this was back in the 40s, right? But it
Mm-hmm.
wasn't so long ago, and I'm sure there's a lot of trauma and generational trauma in there, especially as we're thinking about everything that happened here in the States as well. Because once again, this happened in Guatemala, right?
Mm-hmm.
But we know about Henrietta Lacks, we know about the Tuskegee experiment. We hear constantly about, horror stories about people that have had bad experiences to the doctor. So, it's really important once again that we don't gaslight what has happened in the past, that we don't shy away from everything that has been occurring and the historical trauma, that we address it head on, especially as we're going through the rollout of the COVID-19 vaccine. Um,
Mm-hmm.
we Just a quick reminder once again, that we are doing HIV and STI testing by calling our main line 227-974-4439, and COVID-19 testing as well. We continue to do that. You can also call the main line and also email us at appointments@whitman-walker.org. Shameless plug, D, but let's
that's
continue.
sure,
Thank you so
sure.
much for sharing that. Um, the Now, with all of this in consideration, how do we navigate medical mistrust? How do we go about reaching the people that we need to reach with all of this taken into consideration? There's a lot of historical trauma once again. So how do you navigate that, D?
I got to tell you, well, one thing I want to just go back and point to the Guatemala business a bit. This was the United States government taking ownership within Guatemala
Mm-hmm.
to do this work. I just want to be clear who the agent was. In terms of how I work with medical mistrust, I have to tell you that generational piece is very real for me. Um, when I tell you I had to go back and look at something I feel like I knew, it has that sense to it that this has been the texture of information I got around medicine since I can remember getting information about it. It was, and I think this is a real generational thing. I was told not to tell too much, that your information
Mm-hmm.
is never safe outside this house. A lot of oppressed people have that mindset that I can't tell you everything because I don't know what you're going to do with my information.
What are they going to do with that information, right?
That's part of the thinking. It's also a matter of how are you viewing me. If I come in and I never have a name and I'm never looked at as a human being, yeah? If I'm poked, prodded, and then somebody says something incomprehensible and leaves the room, that's not going to foster a good interaction. So these are all components that go into that universal story that I was brought up with. Of yes, you need to avail yourself of the medical system when needed, and we had a really different kind of view of when needed happened. So
Mm-hmm.
often illnesses went a long time without care because we weren't clear on when we could go. So that's my family, my experience. Yeah.
Thank you, Dee. Thank you so much for sharing that. And once again, going back to the conversation of needles and getting pricked for myself, you know, um, growing up, that question of what was in it. And I think we had an interesting conversation last week about consent,
Mm-hmm.
and what that looks like. And you gave really good examples. And as I'm thinking about myself and my experience, how I navigate misinformation, um, you know, um, I get a lot of I have a sense of ease nowadays, mostly because we have access to the internet, we have access to information. There's been a lot of progress and advance when it comes to science and ethics in science.
Mm-hmm.
So what we're seeing now, when it comes to the vaccines, right? It's research that's been happening for over 2 decades, right? It's not something that just came out of nowhere. So that that gives me a sense of ease and calm when it comes to what I'm doing and when it comes to getting a vaccine, right? In this case, something like the COVID-19 vaccine, which we know is primarily affecting our communities, Black and Brown communities. So we need to get that vaccine, right?
I got to tell you that mine comes a little differently than yours.
Okay.
I think we're going for the same end, is
Mm-hmm.
safe and controlling this problem we have. But I will tell you that even with all the knowledge I feel like I have and I try and share with people on a real personal level, that last step is a leap of faith for me.
Mm-hmm.
It's not that I have intellectually connected to the problem and that's why I'm going. I I connect it on a real heart level. I want to be safe. I'm right in the pocket of people that might fall dead from this thing. So that's no joke for me.
Mm-hmm.
But to think about, I haven't seen my mom in a year. We're both old now. I want some faith that I can have connection again,
Right.
and that is the motivator for me, that perhaps my action will protect others and protect myself. But again, that's not the intellectual knowing. That's the heart knowing that
Right, the
moves in.
emotional side.
Yeah.
Hmm. Definitely. And thinking about how many of us have had to be away from our loved ones and family members and perhaps having to quarantine outside of out of state.
Yes.
It's been challenging, right? But we, of course, as we're doing this series, we're talking about medical mistrust, and we're talking about historical trauma, and how different generations perceive this. And early on, we were talking about some generational differences during our debrief, right? And it's really interesting how that comes into play when it comes to this topic that we're discussing. Anyways, I think we still have time to talk about some myths and facts.
That would be
Um,
great. Yeah.
Last week we talked about some, and this week we have three more that I would like to share around, the vaccine. So let's get into it. All
Okay.
right. So the first myth that I have here, Dee, says that anyone's eligible to get the vaccine. Now, for what we know is that right now eligibility varies by state, right?
Right.
For DC, we will put this information in the chat box as well, but we do recommend that you check out the Vaccinate DC website to get the most up-to-date information. For Maryland, they also have their own website as well, where you can check up-to-date information about vaccine distribution and eligibility. For Virginia is the same way, and they also have a phone number as well, which you can get up-to-date information and mostly about vaccine distribution and eligibility criteria, right? And then,
Hmm.
of course, depending on where we live or where you live, we encourage you to go um, to the site where you would be assigned and pre-register in your state/district for the COVID-19 vaccine list serve. That way you will receive up-to-date information. So we know that in DC we have like the phases that we're going through. So it varies by state. So it's important to stay up to date when it comes to that information. And then, going to myth number two, it says as follows: that you will have to pay for the COVID-19 vaccine,
Right.
right? So as far as we know right now, the vaccine is free for everyone. Your immigration status, your housing status, your insurance status does not matter. It is free for everyone. So once you're eligible, once again, if you check on your state's guidelines or your website, staying up to date, register and sign up. It's free. And then the last myth that I have here, if you had COVID-19, you do not need to get vaccinated. And I
No.
found this one problematic, of
Hmm.
course, but we know that the CDC recommends that people who have had COVID should still get vaccinated, right? They still need to get the vaccine, and that's to provide a more robust, quote unquote, immune response than just getting the illness,
Right.
right? Because we've seen and heard reports in the news from people getting reinfected after having it. So we recommend, that you still go ahead and get the vaccine. Um,
Agreed. Agreed.
Definitely. I'm just going to check some of the comments. Do we have any comments in here?
And then I'll
Uh,
add just a bit while you're doing that.
mhm.
So the list of what's needed to get on with vaccine, um, is sort of the correlation of being able to use computer effectively going into that. If you have an elder in your family and they are looking at getting vaccine or talking about it, please use some of this information to share with them and help guide them through the process of enrolling. I mean, the very face of it for some people is just that's it's overwhelming. So please think about who in your life might need that translation, and if you can help them, that would be wonderful.
Definitely. As we're thinking about this rollout, we want to be mindful of accessibility and access in general,
Hmm.
especially for the folks who might not have access to computers, who might not be as tech savvy. There are phone lines as well available, and we will share that information. You all are also welcome to follow us on social media for all these wonderful resources and our website as well. But yeah, that'd be about it for the myths and facts for this week. Once again, three more. But yeah, the COVID-19 vaccine is free, D. That's you know
That's the
that's
deal.
that's the way to go, definitely. Um,
I really
Now,
expect that we'll have, the rollout will become smoother as time goes on. I just really want people to be knowledgeable and think about what
mhm.
their plan is. There should be a plan of some sort.
Definitely, especially as we're going through these phases, and for we know that you have to get more than one dose. Of course, keep making those plans to get those vaccines as soon as you're eligible. Checking with your local authorities, your state, to see if there's any updates. And things are happening in real time, and things are always changing. So we do ask that you know. You keep in mind that this information is changing as we're talking, right?
Yeah.
And then remember, folks, if you have any questions, comments, or concerns, please talk to us directly. You can always call us at our line 202-797-4439. That's our community health line. We're happy to help and continue having these open conversations. Dee, do you have any closing thoughts?
I really don't. I mean, what I will say is it's been of such benefit to be able to work with you and have this conversation with you. It's very grounding for me. And just to reinforce, learn and make informed decisions. That's really what this is all about. Not to move you one way or another, but to honor where you are and try to help you move. That's it.
Definitely. Thank you so much for that, Dee. Very important. Once again, that we're not, we're working with what we have, right? And very important that as we're addressing medical mistrust, that we continue on, just acknowledging what happened, and thinking of what's happening today, and taking that historical context into consideration as we're doing our messaging around public health and around vaccine distribution, especially with Black and Brown folks. So just a quick note that we will be back this Friday once again, next Friday, not this Friday, to continue this discussion around medical mistrust within our Black and Brown communities. I think this has been very interesting. It's been filled with a lot of emotions and feelings, and for myself, it can be a little bit uncomfortable from time to time to talk about historical trauma in our communities, but these are conversations that we are having, and I think that these are very important conversations to have. Once again, especially as we're talking about this vaccine rollout.
Yes, I absolutely agree. And perhaps, the conversations will help us get some clarity on being able to be mindful of past, but putting it to rest and being vigilant in the future.
Definitely. So remember to stay put following CDC guidelines, COVID-19 prevention guidelines, folks. Remember to wear a mask that covers both your face and your nose. Dee and I, we're not wearing masks today because we are,
Uh-huh.
not seeing anyone face to face today. Continuing practicing physical distancing, right? Not social distancing. Of course, reach out to your loved ones via email, via letters, via social media, via Zoom. Try and reach out. Distance yourself physically, but not socially. Avoid large crowds. Stay home if possible, and continue washing your hands. And then once again, continue following us on Facebook, Instagram here at Whitman-Walker, and also at Real Talk DC_ to stay up to date with all things Whitman-Walker Health. Well, Dee, it's been a pleasure once again.
Yeah.
We are done, but looking forward to our part 3 of this conversation next week.
Well, wonderful. You have a great weekend, and I look forward to next week.
Thank you, and stay safe, everyone.
Take care. Bye.